Hi everyone, my name is Melanie Grant and this is C&M Glass. Today we're talking with our class 2030 for surgical coding in the musculoskeletal system, senses, and operation microscopes. We're going to focus on this first video on just musculoskeletal, and then we'll come back to talk a little bit about our other two sections. So first, looking at the surgical section for musculoskeletal, note the section that you're in is the 20.005 through 29.999, meaning that anytime you're looking up a code for the musculoskeletal section, the first thing a coder should be aware of is what section are you in when you look within your CPT manual. This is very important, especially as coders that are learning, because you'll find that when you're coding sometimes, you may end up in the wrong section, such as the integumentary system. And it's very important that you take a step back and look at where am I at and where should I be at. So always remember your musculoskeletal section is in the 20,000s. That being said, we have a couple of key points we'll be looking at. We're going to start with talk about our global package and what's included when talking about musculoskeletal services, the definitions between open and closed fractures, as well as open and closed treatments. Note the definition for FX being a shorthand and commonly used abbreviation for fracture versus the definition for TX being a shorthand and commonly used for treatment. And then we'll talk a little bit about what it means when you have terminology for wounds and spinal procedures. So the first thing to keep in mind is that the musculoskeletal section is just that, muscles and skeleton. And so everything in between is also part of this. I'm going to turn into my CPT code book and you can follow along with me. I'm in the 2018 edition for professional services from the AMA that's recommended for this class. You may have a different version, and if you do, that's quite all right. If you're in my version, you'll find yourself on page 103 for start of the musculoskeletal section. I like to look at this because I like to see what all do I have within my code book and how is it organized. Because you'll notice that the code book itself does have specific areas. So we have, starting with musculoskeletal system, our general services, followed by neck, back and flank, spine, abdomen, shoulder. You notice how it goes from head to toe, just as most of our CPT manual is organized. At the end, after foot and toes, I have applications of casts and strapping and endoscopic and arthroscopic procedures. So one thing that some coders may find more beneficial is to come to this index and see where their code should fall, as opposed to looking up codes in the alphabetical index. Either method is fine, but it's something you should be aware of as an option. I also love this definition, this particular edition from the AMA, because it gives me all kinds of really great anatomical images and titles and labeling of the different parts within the musculoskeletal section, what's being applied to the different sections within the table of contents, and the labeling within that. So that's kind of neat. You'll also notice that the musculoskeletal section does have its own set of guidelines and definitions, and so as new coders, you should make sure to read these before you get started. Under page 108 to 109, about a page and a half, you have all the bold identifications which run from definitions of closed and open treatments, percutaneous skeletal fixations, manipulations, excisions of subcutaneous soft connective tissue tumors, excisions of fascial and subfascial tissue tumors, radical resections of soft connective tissue tumors, and radical resection of bone tumors. So be aware that those are there, and be aware that if your procedure might relate to that, to look at your guidelines first and make sure you know what's in here. If you don't know what's in here, those are the questions they will put on your test. So let's talk a little bit about global package for a moment. Your global package with any kind of fracture treatment is going to include the initial visit and treatment, as well as routine care, and when it's routine, anything to do with casting if they're billing for a fracture treatment. So it's important to remember your fracture treatment includes everything involved in that fracture. You may recall from a couple of our are weeks that we've gone to the Medicare website to look at surgical global periods. This is especially important in this week as you're doing some of your exercises to take a look at the CMS global periods. Take a look on Novitas, whichever option you prefer, and find exactly how much time after the actual fracture treatment is included in that global package. So always keep that in mind. And remember, there's a couple of modifiers that could apply in the instance that you're within that global package. Inside of your workbook activities, in the medical coding workbook that looks like this, on page 97, you have some exercises, and it talks a little bit about this global package. Okay, so it tells us here the packaging group, that's what it includes as defined by CPT, is sometimes payer-based. Some services, such as routine follow-up, are reported during the global period, are not reported during the global period, and so we should already know that. In the case where you're seeing a patient for something that's unrelated to the fracture treatment or other musculoskeletal service, you can bill an E&M with a 24 modifier. And in the case where a surgical procedure that's unrelated to this visit is done, you can bill with a 79 modifier. So be aware of those modifiers and also be aware of staged procedures and planned trips returning to the OR and which modifiers you might use for those. Okay, so moving on, what we look at here, when we talk about fracture treatment, we first identify the type of fracture that the patient has, the location, and the type of treatment. And so we have a couple of definitions. We have an open fracture, which is where the fracture itself had the bone protruding, or an open wound in the skin where you could see the bone and the break. Okay? Now, if a patient shows up with a fracture and a wound, but it's not where the fracture is and they can't see the bone, then that would be considered a closed fracture. An open treatment is when either the fracture itself is opened or we opened the fracture in order to do the treatment. And so we either open a closed fracture or fracture is open already. And as you can guess, an open treatment is going to include a lot more detail. It's more extensive because we have to close up the actual wound itself. There may be debridement necessary depending on the type of treatment. And some of your codes may include additional services while others will not. So it's important just to read everything that's available within the service and identify if an additional procedure is applicable. A closed treatment is going to be where the provider does the manipulation either by placing a cast onto the arm because the fracture has not moved and relocated, or they manipulate and I use the arm, but it can be anywhere, or they manipulate the fracture in order to put it where it should be and then cast it. And they may do casting or they may do strapping and splints. It depends on the need of the patient and where their bones that were broken are. So remember, when you're looking at closed, you have a couple extra definitions, and these are actually repeated in your chapter reading for this week. An open treatment is defined as a procedure provided to treat a fractured bone that is either surgically opened or not surgically open, but the fractured bone is open remotely from the site. Whereas a closed treatment, according to CPT, is when the fracture is performed with or without manipulation, with or without traction, and without the fracture being opened and visualized. Okay, so keep in mind some of those terminology. Now, obviously, if we have information regarding wounds, a wound is going to indicate that there is an opening of some sort. So when they say, I did certain treatments to the wound, that is telling you that there is an actual open wound. And if they indicate that the fracture itself is part of that, then you would be able to identify by interpreting that documentation. We also want to keep in mind that wounds extending into the muscle and connective tissues are going to be under the musculoskeletal section. So just like with integumentary system, when we talked about procedures happening into the skin, if it goes below the 3 layers of the skin, and you may remember that you had your first layer, your second layer, and your third layer. And below that is your muscles and connective tissues, depending on where it's at. Okay. Woo, that's fun. Okay, so if I have a cut that goes into the muscle and creates a giant wound, then I'm going to not be coding to the integumentary system. It's going to go to the musculoskeletal because that wound is in the muscle, not the skin. Surgery to explore the wound. You have determinations and depths of complexity to the wound, identification of damage created by a penetrating object, debridement to the wound to remove any particles of dirt and foreign fragments, and ligation or coagulation of minor subcutaneous tissues, muscle fascia, and or the muscle. Okay, so these are all identified as parts distinguished between wounds and penetrating trauma wounds. And so these would be penetrating trauma. In all of your wounds, make sure you pay attention to what is it that we're doing, how deep did it go, if there's any kind of indication of retention suturing or multiple layers, those can oftentimes be coded separately. Okay. Then we also have some information here for your spine, bone grafts, laminotomies, arthrodeses, and skeletal fixations, as well as some other spinal procedures. Okay, you have some great information in your book, and one of the things I wanted to talk to you about before we get done here is some of those spinal procedures. Now keep in mind, we have a nice little diagram of our spine here, and we want to remember that just like with the nervous system, when we talk about how many vertebrae are involved, we're doing the same thing when we're talking about spinal procedures. One of the most common procedures you'll find in the spine is going to be an arthrodesis. This is also known as a spinal fusion or a surgical immobilization of a joint so that bones can heal or grow solidly together. There's a couple of details about technique and approach. So you want to remember exactly, when you're reading, is the provider going in from the front or the anterior approach, or are they coming in from the back or posterior approach? You may remember some of these if you've already taken PCS coding, because it's going to be very similar to things we have to identify with those. Now, an arthrodesis can be performed alone or in combination with other procedures such as bone grafting, osteotomies, fracture care, vertebral corpectomies, or laminectomies. When it's done at the same time, a modifier 51 should be appended to the code for the arthrodesis. The reason for that is an arthrodesis is typically considered secondary to those more invasive and severe procedures. And sometimes, like when you have a bone graft, that's the main procedure. And we did the arthrodesis as part of the supporting treatment to make sure that that graft stayed in place. Now keep in mind, when you're looking at multiple vertebrae, you're going to count each one. So if I go from C1 through C3, I have 3 there, okay? Or 2 joints. And so it's very important when you're looking at that, how many joints? I have 3 vertebrae, but only 2 joints. If I went from T1, 2, 3, 4, to T5, I would look at T1 through T5 and count in between how many joints, 1, 2, 3, 4. So if I was fusing 5 vertebrae, I'm fusing across 4 joints. Okay, so these are some of the things you'll want to identify. Let's see, spinal procedures and fusions, and some coded scenarios. I think you're ready. So let me know how you're doing this week. If you have questions, if you have any details that you would like to go over, send them to me at mgrant13cnm.edu. We will be doing our Coding with Miss Melanie segment tomorrow, Wednesday, which will include anything that's perhaps discussed during the coding clinic, as well as emails from you. So go ahead and check out your next video where we'll be talking about some of the senses with the eyes and ears and use of an operative microscope. We'll see you in just a moment.